This video is by Straight Goods News, SGNews.ca.
In our 2011 platform, our government committed to take further steps to reduce trafficking in contraband tobacco, and today we're proud to be delivering on that commitment. I'm pleased to announce that our government is strengthening the anti-contraband enforcement strategy by adding a 50-officer RCMP anti-contraband tobacco force. Contraband tobacco is a serious threat to the public safety of Canadians, our communities, and our economy. It fuels the growth of organized criminal networks, contributing to the increased availability of illegal drugs and guns in our communities. The RCMP anti-contraband tobacco force will target organized crime groups engaged in the production and distribution of contraband tobacco to reduce the contraband tobacco market and combat organized crime networks. The RCMP will also allocate resources to address the illicit manufacturing process, which begins with the illegal diversion of raw leaf tobacco destined for the contraband tobacco market. In addition, a dedicated outreach team is being established to engage tobacco growers and suppliers of raw materials used in the tobacco manufacturing process in order to help raise awareness about contraband tobacco. We are also introducing the Tackling Contraband Tobacco Act, which will create a new criminal code offense for trafficking in illicit tobacco. This bill includes new mandatory minimum penalties of imprisonment for repeat offenders involved in high-volume contraband tobacco, meaning 10,000 cigarettes or 10 kilograms of other tobacco products. Many of these repeat offenders are affiliated with other serious organized criminal activity, such as weapons and illegal drug trafficking. Anyone convicted on indictment would receive a minimum of 90 days incarceration on a second conviction, a minimum of 180 days on a third conviction, and a minimum of 2 years less a day on subsequent convictions. Ladies and gentlemen, we know that the illegal tobacco business has become a smuggling activity dominated by sophisticated organized crime groups. These groups transform their profits from the sale of illegal tobacco into drugs, firearms, and other illegal activities which put law-abiding Canadians at risk. It is abundantly clear that shutting down these networks is vitally important to protecting the health of Canadians as well as helping ensure their safety and security. The introduction of this legislation is part of the Harper government's plan for safe streets and communities, which is one of the 4 priorities identified by the Prime Minister. This plan focuses on tackling crimes, victims' rights, and fair and efficient justice.
Our government is committed to keeping our streets and communities safe and supporting families as outlined by the Prime Minister. Health Canada in particular supports the RCMP's work with the anti-contraband tobacco force. Our government is committed to keeping contraband tobacco off our streets and out of Canadian communities where cheap baggies of illegal cigarettes lure our kids into smoking. There is no place for contraband tobacco, and it's important to ensure every attempt is made to keep it out of the hands of Canadians and, more importantly, our children. Contraband tobacco is a pressing issue, and the availability of inexpensive illegal tobacco products is a serious problem. The availability of illegal tobacco doesn't just undermine our safety, the safety of our economy, it also is having a negative impact on our public health goals. Everyday Health Canada and its partners help educate Canadians about the dangers of smoking, discourage people from starting to smoke, and support those who wish to quit. And we are making progress. The smoking rates in this country is at a historic low of 17%, and the percent of Canadians who smoke on a daily basis is at 14%. However, tobacco use continues to be the most important preventable cause of premature death in this country. Tobacco use is responsible for more than 37,000 premature deaths every year in Canada, which means there's still much work to be done. Our government is committed to helping all Canadians in their fight against smoking. In 2012, I was pleased to renew the federal tobacco control strategy for 5 more years. Under this strategy, we introduced warning labels on cigarette packages, which now contains a national quit line and a web address for people who want help quitting smoking. We also banned flavored little cigars, which were clearly targeted to our children and our youth. In addition, we launched a marketing awareness and outreach campaign targeted at young adult smokers. Going forward, we will concentrate our efforts on the more vulnerable population that have smoking rates higher than the national average, such as on reserves, First Nations, and Inuit. Health Canada will also continue funding government partners to monitor the illicit tobacco markets. I am confident the measures such as these will help us continue the downward trend in smoking prevalence. There is no doubt that Canada has established itself as a world leader in tobacco control, whether it is from a health, security, or economic perspective. Reducing the amount of illegal tobacco on the market is good news.
Including the RCMP agree that most of the vast majority of these illegal cigarette factories are located on Aboriginal reserves in Ontario and Quebec. Why does your government continue to allow them to operate? Police know where they are. Why don't you just shut them down?
I don't direct police operations. What I do is provide police with the resources to do their job. We expect them to do their job.
But you know where they are. I mean, you know what the problem is. Why won't you tackle the problem?
Well, maybe you can talk to the RCMP. We give them the resources. Are you suggesting I interfere with police?
No, I'm not suggesting that, Minister. I'm suggesting you do something.
Minister, what will this new 50-unit RCMP do that you can't do now?
Well, this is a dedicated resource to address the issue of contraband tobacco. We believe that sufficient resources need to be put forward in order to ensure that we can make a difference. And we are making a difference. As I've indicated, thousands of charges have been laid, and we believe that the new legislation will also create another disincentive in order for people to realize that when they engage in this activity, there are real consequences. The other thing is, under the criminal code provision, now there's clearly joint responsibility of provincial police and RCMP to do the investigations. That will, I think, provide additional incentive for police to involve themselves.
A lot of contraband tobacco already comes from the Aglukkaq Reserve, and in that reserve, there's already a task force there. The RCMP, CDSA, the OPP. What is that task force not doing that your task force can do? Or, I mean, are they not doing a good enough job there?
Well, what we're doing is providing additional resources to the RCMP to get their job done, and we believe, coupled with the legislation, that will make a very positive impact in terms of addressing this issue.
Minister Toews, great press release. The tobacco lobby must be thrilled. They probably put their word in themselves. Just curious though, do you have any numbers tobacco factories that contraband tobacco is any more harmful than legal tobacco?
All I'm going to say is that contraband tobacco, from a public safety point of view, fuels the growth of organized crime. It disrupts communities. It is used as currency for other drugs and for illegal guns. I don't want to see illegal guns on our streets. I don't want to see other drugs on our streets.
Minister Aglukkaq, if you could come to the mic, please. On another subject, it's the 10th anniversary of the SARS outbreak in Canada. Is Canada better prepared today to deal with such an outbreak if it were to happen 10 years after the SARS?
Absolutely. During that time, after the SARS incident, we reviewed the pandemic plan in Canada, and we had approved that plan in 2008. I think it was 2008. 2009-10, we dealt with the issue of H1N1, and we rolled out that plan again. Through that experience, we are evaluating how could we do better, and that consultation process is great. There's always lessons learned when you're dealing with public health issues, and during the SARS, there were many lessons learned that strengthened our pandemic plan for Canada. But again, during H1N1, there were lessons learned in that we're incorporating, and this requires the participation of all the provincial territorial health ministers. So going through that process, we're committed to continuing to improve the pandemic plan for Canada.
Minister, finish out about the 50 officers. I mean, are they frontline officers, or are they going to be working in the back office? Are they across the country? Realistically, how many? I mean,
They are, look, most of the problem is occurring in Ontario and Quebec, and I assume this task force of 50 officers will be focused in that area, but there's no restrictions that I've placed on them in terms